Yes, do you have any myths or misconceptions about it? This morning we'll demystify all of it and we'll better understand it. Even if you've heard it before, well, there'll be other dimensions you have not heard of. So bear with us this morning as we discuss that. I am Altiti Saida Sadiq, and that's how you can find me everywhere on social media, on GTV Ghana as well. If you want to step out of their house, you can still take us along with you by going on Facebook, GTV Ghana, and you can watch the show there live whilst you go about your duties. Viral hepatitis is said to be a major public health challenge in Ghana, around the world, affects millions of people, and is a leading cause of liver disease, liver cancer, and premature death. So in Ghana, there's an estimate about 3 million people living with hepatitis. And I'll let my doctor tell us the people who are living with hepatitis C as well. Many people who are unaware that they have the infection, because hepatitis often causes no symptoms until serious issues start to happen. And to which parts of your organs will it start to happen? The doctor will tell us this morning. With us in the studio is Dr. John Gerald Adiboka. He's Programs Manager at National Viral Hepatitis Control Program from the Ghana Health Service. And he'll be explaining what viral hepatitis is. Good morning to you. Good morning. Hope you're well.
I'm doing well.
Okay. When we say viral hepatitis, is it different from our usual hepatitis, or is it the same?
It's the same.
Okay.
But we know that when we say hepatitis, it means inflammation of the liver.
Okay.
So, but we have different causes. You can have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E.
Oh, wow.
Yeah, but the one we are worried about is the hepatitis B and C, because they cause chronic liver disease and liver cancer. Okay. And that is what we are concerned about.
Definitely have to be concerned. So how does one even contract hepatitis? Where does it come from?
So it's a viral disease. As we say, viral hepatitis, it's a viral disease. As you know, viral diseases are common, just like the COVID that came.
Right.
You know about HIV too. So hepatitis 2, as we call it, can be caused by viruses. So when it's caused by viruses, we call it viral hepatitis. And as I said, there are many, but the ones we are concerned about is the Hep B and Hep C.
How serious is the B and C?
So in Ghana, there are a lot of people who are infected with chronic hepatitis B and C. We know that the prevalence in Ghana is about 8 to 9%. Which means about 3 million Ghanaians are infected with chronic hepatitis B. And for hepatitis C, we have about 500,000 people who are infected with chronic hepatitis B. And because it's a silent disease and also cause chronic disease, just like hypertension and diabetes, there are a lot of people who are walking around with their BP being high and having diabetes without knowing. It's the same thing. People with chronic hepatitis B and C may not know their status until they check. And because of that, it may not show any symptoms. You only have the symptoms when you have complications. And that is how serious it is. And by the time you get to the hospital, it may be advanced. You may have liver failure, you may have liver cancer, you may have liver cirrhosis, of which sometimes it's difficult to manage at the hospital.
So under usual circumstances, we should just check every time, or once in a lifetime, at least know that you've tested?
So we encourage everybody in Ghana to check to know his or her status. The first thing to know whether you have it or not is by checking to know your status. If you have it, you can see your doctor, you can see your health professional who will advise you what to do. For hepatitis B, there's treatment. Hepatitis C is curable, which means that if you are tested positive, and you go through the process for treatment, at the end of the day, you're able to cure it. Just like malaria, you go to the hospital, the test is positive, they give you treatment for 3 days, and the malaria is gone.
Right.
For Hep C, we give you treatment for only 3 months, and then you are cured. So it's good when you are positive, you seek medical care. That's better than to rely on other herbal and other medications.
People do that a lot?
As I said, when we talk about hepatitis, can be caused by herbal medications, just about inflammation of the liver. So if the medical and herbal medications can cause inflammation, now you have inflammation caused by the herpes, and then you also have inflammation caused by the viral hepatitis. So you have double infection, or double risk factors causing the problem.
Why would people use traditional medicine though? Is it because they are trying orthodox medicine and it's not working? Hepatitis B can be treated too, right?
Yes,
Okay.
very treatable.
So why?
And with the treatment, then you prevent complication. So, usually with the herbal medications, the orthodox medicine, we believe that we treat.
Okay.
But, most of the herbal medication, they preach cure. And, Ghana, we like cure than what we call treatment. So if I know that when I come to you, you can give me drugs for treatment. And they assure you that, when I give you the treatment, within 3 months, you are fine. And then you clear the infection. So, and then that is why people rely a lot on that. But when they come and we tell them the truth that for viral hepatitis, it's quite difficult to treat and clear it. Only few people will be able to clear the virus when you treat. But you need to contain the virus. And that is the main aim of treating viral hepatitis B.
In the sensitization that Ghana Health Service is doing, are you targeting some of these traditional medicine vendors? I mean, I know that some are approved, some too are not approved, and people buy from all sorts of places. But are you targeting them to let them refer people to the hospital?
For now, we don't have approved herbal medication by the FDA for treatment of viral hepatitis. Most of the drugs that they are given is an assumption that it boosts the immune system to fight against the virus, and based on that. But you have to be aware that for viral hepatitis, your body itself, especially those of us who get it when we adult food, we can clear the virus by itself. So assuming you happen to be the one who is clearing the virus, you go to the herbal person, he gives you medication, then you take it. At the same time, your immune system has cleared it, and he thinks that it's his drug that has cleared the virus.
True.
So that is some of the things that you need to know.
Okay.
So I think when we come to the mode of transmission,
which we are going to now. So how is it transmitted?
So in Ghana, there's what we call horizontal transmission. Most of the transmission in Ghana is through mother to child during birth and during pregnancy. So about 95% of the infection we're seeing chronic hepatitis B in Ghana is through mother to child.
It's like how the HIV was until, sensitization about preventing the child from getting it.
And that is why Ghana Health Service, we are worried about it, because we've seen a lot of people coming to the hospital with chronic liver disease. And then when you end up checking, you realize that it's from chronic hepatitis B or hepatitis C. So that is why we are worried. So as I said, the commonest one is the mother to child. And aside that, mainly is body fluid and then blood.
Okay.
So aside that, people who use needles, and then sharing needles or things that probably involve blood or body fluid, you are likely to get it. You can also get from blood transfusion, even though now every blood in Ghana is being screened. But if it's not screened very well, it means that you can still get the virus from it. And then for sexual contact, it's also possible, even though it's quite limited, but it's still possible you can get it from body fluid and to sexual contact.
Wow.
Yeah.
And where is it prevalent the most as well?
So when we look at the prevalence, as I said, the national prevalence is between 8 to 9%. And when you look at the geography, the high prevalence is in the northern part of Ghana. We have the Savannah region, who has about 22.1%. That followed by northern region, that also about around 21 point something. Then Upper West, then from Upper West, then Upper East. Then as we are moving down the middle belt, the lowest region with the lowest infection is Greater Accra region.
Wow.
Yes.
Wow, what's accounting for that? That's interesting. And it's populated. What's accounting for that?
Yes, so there are so many factors. As I said, the higher the prevalence, the likelihood you are likely to get it, especially from mother to child.
Okay.
So it means that the more mothers who are infected with the virus, you are likely to transmit to your children, so which has been there. So it's recently that, in 2002, they introduced the immunization. So every child that was born after 2002, every child is being vaccinated.
Okay.
Even though with that one, it's not totally covered. Because you are supposed to take the vaccine within 24 hours after birth. So the 24 hours. But so most of them, either some of them may not go to the antenatal clinic for immunization, or they may not
have
the
vaccine.
vaccine available. So these are some of the things that we see. There are other cultural practices that we see, scarification. Those days that they used to gather the babies at one family to actually give them scarification. Some of them, they will circumcise them and all that. You have one man with one blade.
The wanzam.
The wanzam. So they'll go around with either a scissors or one blade.
Yes.
So they'll
Same blood.
cut this baby and ask the baby to bring another one, and then they are not able to sterilize the equipment or whatever they are using before they get to the next person. So these are so many things that can probably lead to that. For the actual adult food, as I said, few get it and they're able to clear, and the 5% that would actually continue to have it until they get chronic infection.
Wow.
Yes, but the rest is from mother to child.
And so the mother to child, what's the targeted efforts?
So for mother to child, the Ghana Health Service and then the Ministry of Health in Ghana, they have there's a policy for every mother to be screened at an antenatal clinic. So if you are pregnant and you go to the hospital, it's a must.
For them to screen you for Hep B, C.
Yeah, so when they screen you and you are positive for Hep B or Hep C, you are linked to the doctor, and the doctor would take care of you. And for mothers who are also positive, some of them are put on treatment. And for the babies, some of them give some medications, they are targeted medications we give called immunoglobulin to prevent the baby from getting the easy infection, to prevent the infection. And sometimes we also give the vaccine. But now the government is also putting things in place to bring what we call the BEV dose, hepatitis B BEV dose.
Yes, so I've heard.
Yeah, within 24 hours after the baby is being delivered, then they give the vaccine, and that will reduce it. Because we've realized that even with the immunization we give, after 6 weeks that we give the immunization. So meaning that there's a window period that is left. So, and the transmissions from mother to child during childbirth, the blood contact and all that. That window is missed. So at the end of the day, you realize that the child has some risks of getting it. So that is why the government is working out to make sure
the birth dose
comes in. Yeah.
Wow, it's quite interesting. How is the treatment like? So is it on the National Health Insurance Scheme? Let's say a mother has it and has given birth, and you say they'll put her on treatment. One is tested positive or not positive. Is the vaccines given for free?
So the vaccines are for those people who are negative, and that one is individual. But for babies who mothers are positive and they need to give the vaccine to them, that one they need to pay immediately. But if it is for the immunization, the normal immunization, that one is the expanded program. That one is free.
For the babies.
For the babies. But what the government is introducing, the BEV dose, which is going to also be free, is the BEV dose within 24 hours. So that every child has the opportunity to take the vaccine within 24 hours.
So what happens if it is left untreated, the B and the C, in adults and in children? What are the signs we even see the children start facing?
As we said, for the signs, most of the times, is what we call asymptomatic, meaning that it doesn't show any signs.
Even in a child?
In a child, sometimes it doesn't. We know that for the acute, we have chronic and acute infection. Usually when you have the acute infection, you can have what we call flu-like symptoms. You can have body weakness. You can have maybe sometimes your eyes can be yellow. Sometimes you see that you may have maybe vomiting and all that. That's the acute component. And usually
yellow eyes is like jaundice.
Yes, we call it, So usually if the acute phase pass, then you develop the chronic phase. But there are only few people who develop acute phase and develop acute liver failure. But most of the people we see, they have the chronic infection, which can lead to the liver failure, can lead to liver cirrhosis when the liver becomes small, and then it can lead to liver cancer.
Wow. I know you talked about herbal medication, but what are some of the myths or stories that you've also heard associated with how people treat hepatitis B? People go to prayer camps like breast cancer. When they are diagnosed of breast cancer, they go to pray for it to vanish.
Yes. So people believe that there are a lot of myths about viral hepatitis B and C infection. The first thing that they think that is a curse. So when you are having it, or someone has cursed you in the family, so they intend to seek spiritual care or help. So they go to stay prayer camps, praying all the time than seeking them.
And the liver will be destroying.
Yeah. So we have people who would not even want to come to the hospital because they believe there is someone who has given it to them, and they are being cursed. So, but it's never true.
It's not a death sentence.
Yes, it's not at all. We know that for viral hepatitis, a medical condition that can be treated, and for Hep C, it can be cured, which is what they need to know. The other myths about it is that people think that, oh, if you're having viral hepatitis and you eat with someone, you're likely to get it.
Exactly. That's what they say. True. Because they say saliva.
No.
See, okay.
No. Kissing, you won't get it. Okay. People just think, as I said, for the adults, most of the time, when your immune system is built, you're able to fight the viruses.
Right.
Yeah. And then some people also believe that you can hurt someone, you can live with someone when the person is infected and all those kind of things. And because of there's a lot of stigma around. And that's why we are trying to make sure that we create awareness to let the people know that viral hepatitis is not a disease that when you touch, just like the COVID, initially when COVID came, we believe that the more I touch you, are likely to get it. Now, now because we understood the way COVID is just like some Qatar. Now, if people are having COVID, but we are not worried about it. Yes, so it's the same thing. Right. So because of the lack of awareness, people don't know what it is. So because of that, when someone is infected, we have a lot of people who are denied jobs because maybe they were tested positive for Hep B. We have people who are denied traveling outside the country. And then we have even those people who, the chefs, and then those who cook food. Yeah. When they will ask you to go and test for Hep B and Hep C, when you come and the Hep B is positive, they will ask you to go and treat and come. And then until you are cleared, we know that for hepatitis B and C, you treat it. You don't, and it's not that the food that you give to the people that you will get it, not at all. So it's a myth, and people believe and give me a lot of stigma. You can imagine you are at your job, they come to do screening, you are the main person there, and they'll ask you to leave because they think that you are having viral hepatitis B or C infection. So it's something that we are much worried, and awareness is what we are talking about here.
What happens when people are diagnosed because of the stigma? Are they counseled or like what support is given to them?
So that's the unfortunate thing in terms of diagnosis and then the follow-up treatment. You know, everybody goes around to do, there are a lot of people who go even houses to screen people. People walk to the pharmacies to do screening. People also go for church activities and they come to screen them. Then when they screen them, they will tell them you have hepatitis B and they leave you. You see, because of lack of understanding. So what we are encouraging is that you screen someone, refer to the doctor. We know that people are already having the disease without knowing. If they are dying, they would have died before you met them. So if you have seen them, you have screened and they are positive, direct them to the right people and they will follow them up. Yeah. So that is the best way to go. So knowing is better than not knowing. Okay. Yeah.
Because people will be in the denial that as far as they don't know, it won't kill them. You hear these African sayings. For couples as well, is it something that is part of the test that they usually do when you're about to get married?
So not all churches, and then not all, let's say the Muslims, some few do. Okay. So they refer people to go and do the screening, which include HIV, sickling, Hep B and Hep C.
Okay. Hep B and Hep C is bad. Okay.
But some people don't screen for the Hep C. You see a lot of people screening for only Hep B, and there are a lot of people who don't even know that
Hep C even exists.
Hep C exists. True. And it has the same risks of causing liver cancer like the Hep B. So most of the couples that come, they are not asked to screen for the hepatitis C. But those that they refer them, they do, which is very, very, very good.
Very good. Yeah. Okay. So kudos to them. What can we do collectively to help reduce down the numbers, the millions? What have other countries done that has worked for them? Is it an African illness? No?
No, it's worldwide. Okay.
So every race...
Over 3 billion people
are walking the earth with hepatitis B.
A lot of people are walking with this viral hepatitis. So a lot of countries have taken this into their own hands, and they've done well. One of the countries, Egypt.
Right.
And we are also benefiting from Egypt. I'll come to that point.
Okay.
But the first thing we need to do as Ghanaians is awareness creation. There's a negative thought about viral hepatitis in Ghana, and that is why Ghana Health Service, the health workers, Ministry of Health, we are working together to make sure we create awareness. And the awareness is not created by only the health workers, it's created by all of us.
Right.
You sitting here, you can do a lot by talking to people about how it is being contacted, and then give us more space for us to discuss this.
Ghana Health Service, you need more airtight to discuss it. Absolutely,
we know. Yeah, so it's very, very important. So we need everybody on board, community leaders, church leaders, everybody on board to make sure that we talk, create opportunity to invite health workers to talk to you about that. That's the first thing that we need to do. The second thing we need to do as a government, for screening of viral hepatitis B and C is part of the health insurance.
Okay.
Yeah. So if you go and you want to test, and they actually provide the services there. And we are also, as a free primary health care is coming,
right,
we are also working with them to make sure that they can add the virus screening to it.
And what difference will that make? It will be in the rural communities,
so
like
that
the CHIPS compounds. Yes. Okay.
Viral hepatitis is not for the rich. It's not for the poor.
Yeah.
It's for all of us.
Everybody.
So no one. So far, you've been giving birth in an endemic country like Ghana. It means you're at risk. So you don't know who is infected, who is not infected. So which means that at the end of the day, all of us are infected. So we have to all do that.
Right.
And that is why we are encouraging everybody. Know your status now is very important. If you are positive, there are medications for you. And then if you are negative, then you go on to take your vaccine, which is very important.
Absolutely. Yeah. Media sensitization, I hope you are engaging the local media for the various languages that they speak as well.
So yeah, so from the Ghana Health Service point of view, from the headquarters, we are doing a lot of activities, and then we are also decentralizing it to the regional health directorate and to the district health directorate and to every clinic.
Okay.
So we are encouraging everybody. Now, the World Hepatitis Day is coming on the 28th. But we have used the whole of this month to do campaign. I think we have been on so many radio stations, so many TV to discuss this one.
Right.
And then we also, some of our colleagues, health workers, are also in other regions, other communities, doing the same education. Some people are going to the communities to do free screening. I've had a lot of discussions with some of the MPs also trying to do screening in their constituency, which is also good. And some individuals, the civil society, there are a lot of them, Hepatitis Alliance, Liver Foundation, and all. They also go around to do a lot of screening for people. And I think we need a collective thing. It's not a section of people you go and screen. You can't screen all the people in Ghana. So it must be targeted, and then all of us involved. That will be better.
My foundation, MultiTK International, maybe we should start thinking of, we are a maternal health foundation, screening mothers as well in the rural communities.
Oh, really?
Yes.
So then you'll be welcome in So the Ghana Health Service, they have some particular policies for the pregnant women.
Right.
The first thing is about the mother-to-child transmission, where all mothers are screened. So there are sometimes you go to the hospital, they don't even have the strips to screen the mothers. So we can look at that.
Absolutely.
It's the rural areas.
Absolutely.
Some may not even go to the antenatal clinic
at all. It's a problem we've been dealing with.
You know that.
Trying to encourage them.
So as we are coming out with the birth dose, we are looking at ways and means we can tackle the traditional birth attendants, so that we can
go once and they never come till maybe they are in labor.
You don't even see them.
No,
they deliver and then the child is there until the child is grown. And you know the way of our delivery, no protection and all that. So we need you on board. Definitely. And then we have what we call triple elimination coming, where you check for HIV, you check for hepatitis B, and check for syphilis. And the government is working to implement
syphilis.
That one. Yes. Okay. So with the triple elimination is something that is being worked on and is being funded. So in that one, it means every mother will screen for chronic Hep B. So we're trying to see from there what can we do in terms of treatment.
Absolutely.
And then the birth dose too is important. So we need you to whatever you think you can reach.
Whatever we can do, we just might, we'll definitely support.
Yeah.
But Doc, what are the, before you go, the projections? If we do all of this together,
Yes.
Ghana Health Service, you, the medical people, the patients, the media, what are the projections?
So
by 2030 is where the SDGs are headed.
Yeah.
So.
The WHO expect that by 2030 we say eliminate viral hepatitis.
Is it possible,
Yes.
realistically, in Ghana or in the world?
In the world, that is what we say, eliminate it.
Okay.
But let me tell you one interesting thing. In Ghana, WHO expect that by 2030, about 90% of people who are infected with chronic Hep B should be diagnosed.
Okay.
And you know what Ghana?
Diagnosed.
Yes. You know what Ghana is doing?
Tell
They are
us.
less than 10%
Of the diagnosis, of the 90%.
of the 90%.
What?
So 10%. Now they also expect that about 80% of people who are diagnosed should be on treatment.
80%.
Should be on treatment. In Ghana, less than 1% are on treatment.
Oh my goodness.
So you can imagine that we are not even getting well.
We have a lot of work.
We have a lot of work to do. And now we have how many years to enter
2030? We're in 26.
Yes, we have only 4 years.
3 or 4
so we have
years.
3 years. So
Yes.
it means that we have a lot. We have a lot to do. So we are not getting anywhere. Because we know that for liver cancer in Ghana, all cancers in Ghana, liver cancer is the second most common cancer. And the one that causes death in Ghana is liver cancer. And it's something that can be prevented, can be treated. Just like cervical cancer, you give the HPV vaccine. So Hep B the vaccine is also there for you. So it means that we have a lot to do. And for Hep C, what we are doing right now, with Ghana Health Service, Ministry of Health, and then in collaboration with the government of Egypt, we have free Hep C medications available in all teaching hospitals, regional hospitals, and some selected district hospitals. Meaning that if you are infected with chronic Hep C and you go through the right process and you meet the criteria for treatment, you just walk to the hospital and they'll give you the treatment free. The treatment is when you look at the normal cost of treatment, it's between 6,000 to 10,000.
The treatment of hepatitis C.
Yeah.
And the government of Egypt and government of Ghana is giving it free now.
Free. So you don't need to do anything. And then this one is working. You just need to take it for only 3 months. And then you are cured.
Wow.
You are killed. And you've prevented a lot. Because the burden for the disease causing, most of the people who had it from their childbirth, by the age between 40 to 45, that is the time that you develop the complications. So you can see that that's the time someone has gotten a new job. That's the time that someone has married.
Life begins at 40.
Yes, life begins at 40. And then the person is gone. So our productive age group, they are dying. You wouldn't know until you get on. You understand.
Yeah.
So if I tell you the gastroenterology, those who take care of the liver disease, when you come to their clinic, you'll be sad. Wow. You'll be sad. A lot of people are dying. And young people. And you get to a point that you can't do much for them.
Kidney failure and things.
Yes.
You didn't know the livers are.
Oh, when you come to some hospitals, they are equally. They're almost the same. Until you won't get to know until you get involved in taking care of those people.
It's quite serious. I think that really it's when they say knowledge is power for lack of knowledge.
Yeah.
Because if there's free treatment for Hep C and look at the cost involved and people don't know, it's quite a challenge. And also the misconception and the myths and not wanting to get diagnosed because it feels like a death sentence. But hopefully, collectively, as you said, we'll be able to get people to know, understand the importance of knowing their status, reduce the numbers drastically. 2030 is around the corner, and the goals and targets that we've set, WHO has set for Ghana Health Service and, countries alike to be able to reduce the numbers of hepatitis B and C and chronic, all the other chronic hepatitis viral infections across the world. So thank you so much, Doc, for all the information that you've given us. You said World Hepatitis Day is on the 28th of July. Yeah. Where is it happening? Is there like...
What we're doing on the 28th is that, as I said, the whole of this month is awareness. And this is one of the things we're doing. Is across the whole country. All the regional districts. And then at the headquarters, we are doing screening from tomorrow till Thursday. for all the staff. So I will encourage all managers, all CEOs to also screen their staff.
Okay.
You can get involved. We can come and screen your staff for
Absolutely.
you.
Absolutely. GBC would love that.
Yeah, so we can come and screen your staff, talk to them and all that. Just do some education on that, and we'll
so any company that wants that to reach
yes, we can. Yeah,
we
can do that for you. We can do that for you. So on the 28th, we'll be having the commemoration at Ministry of Health, where we'll be inviting some dignitaries to come. Because we want to create awareness. We're inviting the minister, we're inviting, our director general will definitely be there, and other stakeholders will be there, and then the ambassador
to Egypt. Okay.
Because they are our main partners who provide us free Hep C treatment. So we are encouraging everybody. You can do the screening at your village, at your community, at your church. Just do it.
Just do it.
If you need help, we will help you in terms of get education, and then sometimes we may be able to get NGOs who are ready to provide the test strips. We'll be able to do that for you.
Okay, thank you so much, Doc. So when you go on Facebook, you can see the conversation again. Doc mentioned a number of NGOs that you can reach out to and how collectively we all need to support to reduce the numbers. Estimated 3 million people are living with hepatitis B in Ghana. Approximately 440,000 are living with hepatitis C, and that's how serious it is. So know your status so that we can reduce really the mother-to-child transmission as well, because chronic acute chronic liver conditions, may manifest if hepatitis B, C leave or go untreated. And so it's very important that you know your status and you create more awareness. Ask your colleagues at work, your family members, if they have screened for hepatitis B and C, so that you can be put on treatment. Thank you so much, Doc, for all the information. Dr. John Gerald Adiboka is Programs Manager, National Viral Hepatitis Control Program, Ghana Health Service. And he says that all will climax on the 28th at the Ministry of Health, and the commemoration will see the ambassadors, the minister himself and herself, the deputy, among other dignitaries, as they climax a World Hepatitis Day. But before that, there's a lot of conversations that's happening across the board to be able to create awareness for action to end the viral hepatitis in Ghana. I'm Max Decider Sadiq, and there's lots more on the show this Monday. Do stay with us.
A tribute to the overlord of Dagbon by Nana Gazor and all musicians and actors in Dagbon.